Treating patients here coming in off the street with sprains, with fractures, with broken bones, people who've been out in the snow and have slipped and fallen, not being able to gauge just how slippy it is underfoot. Now, perversely, it's actually been less busy here in the last couple of days because people have been staying at home. But they are worried that as people start to venture out, it will become more difficult for them. And so let's see what they have in place here to deal with that. And Sandra Taylor is the Chief Executive of the Hospital Trust here. Just tell me, first of all, that's the case, is it? You've been okay so far, but you're expecting more patients to come over the next couple of days?
Yes, it's always the case that accident and emergency departments are inevitably busy, but it gets more busy after the worst of the snow. People venture out, they slip, they fall. Last week, for example, after the worst of the snow, we doubled the number of fractures. We had 118 fractures within 2 days, and obviously that requires a lot of treatment. We also have a large number of elderly people who've been locked at home, may not be properly taking nourishment and heating. So all of that comes in. So we'll expect over the next few days an enormous number of people to come to our hospital.
Now, how will you cope with that? Because you've got, obviously, to get your staff in place to be able to deal with it. Are you able to be confident that they will be here?
Yes, and I must pay tribute to the staff here at Barnsley. They have, over the last 24 hours, made absolute tremendous strides to be here for patients. Last night we had over 30 medical staff sleeping in makeshift beds in order that they could keep clinical services running, and we had emergency staffing in covering all the wards so that they were safe. Our emergency department has got plans in hand for the next few days to ensure that we are capable to deal with and with the needs, and with the support of Yorkshire Ambulance, volunteers and indeed relatives, we've been able to maximise the number of patients able to be discharged, so we're keeping a good flow of available beds.
Sandra Taylor, Chief Executive, thank you very much. They're saying then here they're confident. They've even been checking that staff members who are normally, say, doctors, nurses, cleaners, whatever, if they have extra skills they can bring to the fore here, say they know a bit about being an electrician or a plumber, anything like that on the side, they're saying tell us about it because we might need to call on those skills as well. But they say they're confident at the moment. You heard there, though, they are aware that things could get worse here in the days to come.
Judith, thank you very much. Well, the snow and ice has obviously had a huge impact on travel today. Airports in Bristol, Plymouth and Exeter were closed, but the main problems were at Gatwick, which had to be shut for most of the day.